That's how you measure actually levels. And it's getting dark. Let me go here.
Getting dark, too dark to see.
Really getting dark.
I feel walking on heaven's door.
This box use the leaves of these trees. Then these trees are left. So it's like
right now, yeah. Knocking on heaven's door. See, I have a place for make. I can stand it anymore. Welcome to the platform, my friend. You know, this is we come here in the evening and we answer some questions that we usually talk about epilepsy, you see, and some questions of the topics that I've been receiving. Mayford, welcome to the platform. Hi. It's a question time. Anything? Welcome, Mayford. Mayford, welcome. Which country are you coming from, Mayford? Are you in US, Africa, Asian countries, or Russia also? Which country are you coming from? Let's get to know each other as we answer the questions that are here. We had a topic previously about Mayford, well, that's I've spelled it correctly. We had a question on okay, nice one. Like the video as we call some people in, like the video as we call some people in, as people come join in. We had a session on atonic epilepsy, and atonic epilepsy, we said, is affecting muscles. Anything that is attached to a muscle, a person get affected to it. So welcome everyone that is watching, everyone that is on the platform, everyone that is watching me. Always thanks for everyone who is coming to my platform, everyone who supports me and asks questions and makes us to know we want to have good health every time. Health is very important, my friend. Health is very important. So these things that we talk here, they are of help to ourselves and even the people that are watching, or you yourself. You can help someone by doing what? $1. Claudia Katlobol. Hey Claudia, which country are you coming from? I see you have given something there. Claudia Jotreval. Oh, Claudia. Roberta Ramos. Welcome, my friends. It's been long, Roberta. Hope I'm from Guatemala. Oh, okay. Nice. Thanks for the dollar. We're talking about epilepsy. This is a week of talking about epilepsy, and everyone who is here, welcome to the channel. Thanks so much for everything and subscription. For your subscription also. Roberto Ramos, hope you are good. It has been a while. I've not seen you, but hope it's positive engagement and some things that you are engaged to. So we talked about okay, nice. Claudia is giving me a flag. Which country is that? the blue Argentina. Claudia, you're from, is it Argentina? Okay, I think it is from Argentina. So, welcome, my Guatemala. Yes, welcome everyone. Hope Roberto Ramos, you are good, and even if you have not been coming, I think it has been a positive push on some. Sometimes you can have engagements that are good and they're pushing you to be. Yes, also it has been a long time I've not talked to Jatin. Okay. No worries. Welcome to the platform. When I come at this time, Roberta, what is the time where you are? Claudia, what is the time where you are? Thanks for that dollar you have given out. Thanks for the dollar, and everyone who is here, you be blessed. If you are watching, if you are coming in right now, be blessed for what you are doing. Be blessed for everything that you are doing. Welcome. It's a session whereby we 3:39. Okay, here it is 9:39 p.m. Imagine 9:39 p.m. at night, and we are doing good. We are continuing. We are doing good. And thanks for coming in and telling us that you've been good. Okay. Thanks so much, Roberto Ramos, for everything that you're doing. Mayford, Bangladesh video. Oh, Mayford, Bangladesh from India. Yes. So before I start the topic of answering questions, let me welcome Mayford, Roberto Ramos. Roberto Ramos is one of my biggest fans, but at times engagement makes her not to come on the lives. At times, engagements can make you be out for some time. Claudia from Guatemala, thanks a lot for being here. And everyone who is watching, if you are a new person to the channel, if you are new to the channel, this is a medical channel. We talk here issues concerning life, health, and all sorts, of everything. So welcome, my friends. Welcome to the channel. If you have not subscribed, please subscribe to the channel so that maybe you can be getting notifications. When you get notifications and so forth, you can save a life one day. With us, these topics that we are talking here and the questions that people are asking, they can save a life. Sometimes they save a life. You get. So, my good friends, welcome to this platform. Welcome to this platform that we're in. And when I come at this time, most of the time, what I usually do is I answer questions. So, if you have any medical question that you've been thinking of, I'll be answering questions that from my email that people are asking while I was having the other live. So the first question, every time I do something like an epileptic or seizure, people ask, what is epilepsy? What is epilepsy? Epilepsy is a neurological disorder. We said it's a neurological disorder where a person has repeatedly unprovoked seizures caused by abnormal electricity in the brain. Your brain has kind of electric balance. Some electricity in your brain. So what is epilepsy? When the balance is not okay and the brain is firing randomly, that is when your nerves starts to have, and then you start convulsions, You see, it's very important to know what epilepsy is. Thanks for those likes that are coming in. I've just started. If you are a new person, always know that. Please subscribe. Hit the like button. Subscription is important. Mostly on these medical talks, it is very important. You can find yourself at a position whereby you don't know what to do, but these videos can guide you on what to do as a first aid or what to do so that you can live a better life. You see, that was the first question that was asked. What is epilepsy? Bangladesh video. Okay, we're continuing. Everyone that is watching, if you have any question, please just feel free to ask the question that you have. Don't be shy. Ask any question, medical question. Someone has asked here in my email, can epilepsy be cured? What do you think about it? Can epilepsy be cured? That is a question that people have asked for so many times, and I've said it depends with the kind of epilepsy condition that you are having. And you know, epilepsy is abnormal electricity in the brain that causes you to have convulsions. You see, so the convulsions are the ones which can make your brain to be injured more. So some people outgrow it. When you are a child and you are growing, and you are epileptic, you can reach a place whereby you are not epileptic anymore. The epilepsy has gone away and you are stable. Some people outgrow it. Alicia Baosia. Hi Alicia. Hope you have been good. Welcome to the chat. Hope where you are right now it's okay and you are nice. So some people outgrow it or become seizure free with treatment. When you are getting the medications of seizures, you become seizure free. So you live a normal life because the treatment is helping you to stay away from the seizures. And you know, more seizures and convulsions can destroy your brain. So you see, repeatedly unprovoked seizures caused by abnormal electricity activity in the brain. You know, when you are taking your medication, you stay away from the convulsions. So you have a good life. Continue coming in. Alicia is here. Welcome, Alicia. Thanks for tuning in. Someone has asked, Ananda, today we are going to question by question. If you have a question, who is watching, if you have a question where you are, don't be shy to ask. Just ask that question. Let's get to answer it. Or we can also talk about it. Let the people that are in the chat help us to understand. Someone has asked, what causes epilepsy? Epilepsy, no fever, low blood sugar, drugs withdrawal. You remember we talked about them. Drugs withdrawal, infections, because infections can end up to get into your brain, and then you have some epileptic moment, like you get some fevers, the real fevers you get. Birth complications. Sometimes our women get birth and then you see they get some complications. Oh, Mr. Beta. Hi, Benjamin. Mr. Beta is here. Mr. Beta, welcome to the channel. I'm just answering questions that are on my chat here. So tumors is another cause of epilepsy. Mr. Beta, welcome. If you have not liked the channel, please hit the like button. And if you have a question, any medical question, forget about seizures, any medical question, ask. We can talk. You know, tumors, you have had people that have a growth in the brain. They can press somewhere in the brain and then you start having seizures. Thanks. It's Mr. Bet HR. Oh, you know, Mr. Bet, I've had uncle calling you every time Mr. Beta. So I'm used to that. Mr. Beta, you are a better person, but I'll start calling you Mr. Bet. Mr. Bet, the human resource manager. Okay, Mr. Bet. Now, let's continue. Tumors that grow in your brain. Some tumors can grow in your brain and then you start having convulsions, you know, or sometimes no known case, you're just having convulsions because genetically maybe your brain cells grow. Genetically you have acquired brain cells that are problematic from your parent, but the brain itself, anatomically, physically, it's okay, but it is just causing electrical impulses that are abnormal. That is what we call epilepsy. Are all seizures epilepsy? No, all seizures are not epileptic. There are some things. It's okay. Keep up the good work. Thanks, Mr. Bet. all seizures are not epilepsy, my friend. No, all seizures are not epilepsy. You see, fever, low blood sugars, drug withdrawal infections also can cause. They can cause. And it doesn't mean that you are epileptic. The total cause of epilepsy that we usually know, it's genetic, and we have stroke, infection, birth complications, tumors of the brain, or sometimes no known case, the way I've just explained. Let's talk about, can high fever cause a seizure? There is a high fever can cause a seizure, especially in children. These are called febrile seizures, and I said it is a situation whereby the body is undergoing massive inflammation, and when the body is undergoing massive inflammation, what happens? You start having convulsions, because the mediators of immunity are all over, and now you are convulsing. I have a cousin who has epilepsy. Can he be treated completely? Yes, Mr. Bet, that is a question that we have just talked about. Can epilepsy be cured? Some people outgrow it, and it depends with the cause of epilepsy. Mr. Bet, check around your cousin's line. Is there anyone else who has epilepsy? Genetic epilepsy you cannot cure, but because the anatomy of the brain is okay, but the brain itself has come with cells that are not working correctly. So what we usually do, we give drugs that these people can take. These people can take the drugs, stay out of convulsions completely. Oh, no one else. If it is no one else, maybe what I can advise Mr. Bet is you go to do some tests. See a doctor where you are, a physician who can do some MRI of the brain and check some blood works on that on your cousin, so that you can get to know if no one, it means it's not genetic, then there must be something that is provoking it. Most of the things that provoke are fevers, massive inflammation, fevers, low blood sugar, drug withdrawals, the ones we have said. Something growing in the brain and you are presenting with, it can be growing so gradual that you don't notice that you have something that is growing in your brain. So these are things that we usually see, and we know that this person is not epileptic after we have run all these tests. But when that thing is corrected, the seizures go away. So that is it, Mr. Bet. I'll advise you so much to see a neuro doctor or a physician who can do those tests, like do an MRI for the brain and some blood works, to rule out that this is genetic and we can do nothing. This person should just live on drugs. It is very important. Is epilepsy contagious? Contagious means you can pass it to someone as flu or through blood, like HIV. It is not contagious. It is neurodevelopment problem from the brain. It is neurodevelopment problem from the brain. So you can catch epilepsy. You can't catch epilepsy from another person. Welcome, Mr. Bet. You cannot get epilepsy from another person. Can flashing lights trigger seizures? It's important. In some people with photosensitive epilepsy, flashing lights can trigger the seizures. There are some people who have photosensitivity. So when you are flashing the light, they trigger the seizures. And when they trigger the seizures, you start having the convulsions. Okay, now let's go to, can stress trigger seizures? Of course, stress can trigger seizures. It is very common. Stress can trigger, stress, sleep deprivation, illness, and mismedications can trigger seizures. because when you are stressing your brain, thinking so much, thinking so hard, you can trigger seizures. And seizures, when they are triggered, you cannot relieve them unless you are in the hospital to be given anti-seizures, and they can injure the brain. And we said when they injure the brain, what you can get something that is called encephalopathy. Encephalopathy is not a good situation. Can someone swallow their tongue during a seizure? That is something. African mom, welcome. I'm just answering questions from my email address that I got. Welcome to the channel. Hope you are doing good, African mom world. Hope you are doing good. Welcome to the channel, and you can stay around and listen to the questions that people have been sending about the topic talked. Can stress trigger seizures? Yes, we said stress is a bad thing. It releases some catecholamines, some steroids in your brain that can trigger seizures, the real seizures. If you are stressed up, always it's good to know how to manage. And some people can get stressed up until they get seizures, and family genetically there is no one who has ever had seizures. So stress is one thing that can destroy your brain. Can someone swallow their tongue? No, we said no. That one cannot happen. Someone cannot swallow the tongue when having the seizure. Someone cannot swallow the tongue. Now, should you put something in the mouth? Even that one, we have talked about it. You don't put anything in the mouth of a person who is convulsing. You will injure this person, even if it is atonic seizures. Don't put something. When is a seizure an emergency? You see, they are the same questions that people repeat every time, and I've been answering them. If it lasts for more than 5 minutes, but mine, I said 3 minutes, but the journal say 5 minutes. Onik, hi Onik, you've been gone so long. How are you doing, Onik? What happened? Are you okay? When you get lost for so long, people start asking, where is Onik? So Onik, hope you're doing good. And everything where you are is okay. Now, or if a person, let's say, if the seizures repeat several times, my friend, the coffee cakes, the weekend has been so long and we have not talked. I wish you had WhatsApp, coffee cakes. Please download WhatsApp in your phone so that I could just be calling you direct. You see, I wish you had. The weekend has been so long. You saw me with meetings, friendly meetings, friendly chats. So coffee cakes, welcome to the channel. We are talking about epilepsy. I'm answering questions about epilepsy that we talked about today. Okay, nice. I will get. Okay, please download WhatsApp on your phone, copy cakes. We can also call and talk. Now, what should you do during a seizure? A very important question. What should someone do during a seizure? Protect the person from injury, turn them on the side, and the seizure, and time the seizure. That is, someone asked about a first aid for a seizure. If someone is convulsing, turn this person on the side, on the recovery side, and then time the seizure. They should not go more than 3 to 5 minutes. If they go more than 3 to 5 minutes, rush that person to hospital. It is a very important thing. Emergency, we said it's an emergency when this person is 5 minutes or more. It turns to be an emergency if this person turns to be 5 minutes or more. Can people with epilepsy live normal lives? Can people with epilepsy live normal lives? Yes. If they have drugs, and they're taking care of them well, they can live a normal life, especially if it is not a fever that is provoked by something. If it is not a fever that is provoked by something that is like what? Infection, tumors in the brain, because tumors can grow, and when they grow, they are pressuring the brain. And when they are pressuring the brain, what happens? You continuously have the seizure sessions. When is a seizure an emergency? That one I've answered more than 5 minutes, but for mine I've said 3 to 5 minutes. As a person is convulsing, the brain is getting injured. The brain is getting injured. Can people with epilepsy live normal life? That one I've really answered it correctly. Yes, they can live a very normal life. Peter, hey Benjamin, Peter N. Hi, Peter, you've gone so long. Hope you're doing good, Peter. How is you where you are? Guys that are watching, if you are new to the platform, Fiona, hi Benjamin, hope you are well. Yes, I'm well. I'm answering questions, Fiona the lawyer. Hey, when you graduate, you'll be working for me. Very soon, when you graduate, you'll be working for me. Onik is here, Fiona, and we're talking. Peter, welcome. Fiona, very soon I'll be visiting Benjamin. Share live stream Instagram. Thanks, Peter. Thanks, Onik, sharing this live stream on the Instagram. Fiona, very soon I'll be visiting Uganda. Hope one day or 30 minutes or 2 minutes, maybe we can meet. Hope you are near Kampala. We can meet and we can do a video and tell people, look, I met Fiona, you met Dr. Ben, So my friends, I'm answering questions on seizures. I'm answering questions on seizures. If you have any question that you need to ask, please ask any question that is medical or any question that you think is vital to a human life or better for a person or something that has been giving you some strength. Now, there is this question that people ask every time. There is people that have epilepsy. The epilepsy that is called atonic epilepsy. They walk around with helmets because they don't know where they can get the attack, and if they fall down and hit their head. Are you single or married? I'm married. Fiona, I am married. Fiona, I am married. I'm not single. Thanks for asking. Ask any question. Now, when I say my people ask any question, the usual question I usually get is, are you single or married? Very funny. Even Onik is laughing at me, my guys. Even Onik is laughing at me. No worries. It's good to say the truth. Fiona, you my diamond. Okay, I can see it has started boiling up. Now, let's talk about that's good. How are your wife and children? Hope they are well. They are good. At home. I'm still at work. You see, I'm still wearing the this for work. I'm still wearing this for work. So I would say this. Welcome to my channel. Any person that is new, if you have Instagram, my friend, share this live on Instagram. Let's get some people here. Let's get new people. Fiona, thanks for tuning in. I'm answering some questions about epilepsy, and it is called atonic epilepsy. So I was saying it is very strange that some people walk around with helmets because they are epileptic, and the kind of helmet they wear is called, why they wear the helmet is because when you get atonic epilepsy, you get to an atonic situation. You can hit your head on the ground or on a stone. So the helmet helps you to stop that situation. So can lack of sleep trigger seizures? Yes, we have said if you are always watching and you can one day get epileptic. You see, do epilepsy medication cure epilepsy? No, they don't cure epilepsy. If you have any question, please ask any question you have. So Benjamin, Fiona, agree, welcome Armenia 2030, and we have Fiona. Oh Nick, we will support you, no worries, no worries. We will be there to support you fully, and we will be there to tell everyone that you met online and everything went okay. So we saw that there are two neurotransmitters, GABA and the other one, which is these are the kind of I like it when GABA. I can see someone is asking something here. Now, so we said there are two neurotransmitters. One is called GABA aminobutyrate, and then the other one is called glutamate. So glutamate is the opposite of GABA. Glutamate stops the excitability. GABA stops the excitability. Glutamate is excessive production of the other of neurotransmitters. So when you are having an abnormal electric session on your head, these two heat up, and that's why you convulse, because they are not relating and they are not gradually suppressing the other one. They are not suppressing the other one. So as we continue, my guys, as we continue, the control of GABA and glutamate, GABA and glutamate is the one which makes the balance to be there so that you cannot get a convulsion. So we cannot cure epilepsy. What you can do, the drugs work on these two, glutamate and GABA, to always balance, the excitability, and So can epilepsy affect memory? Yes. Do you have a pharmacy? Yes, my hospital has a big pharmacy. It has a big pharmacy, and every drug is there. You are interested of learning pharmacy, Fiona? If you are interested, it's a good course. It's a good course. You can do it besides doing the law that you have. You have a hospital. Yes, right now. Check on my some of the videos. The one that I did yesterday, I was the one that I've written, health service manager. You will see it. I started from the reception, going to the rooms, doing some things, checking on some things. Check on it. You will see. Now, epilepsy a mental illness? No, it's not a mental illness. Epilepsy is not a mental illness, my friend. Epilepsy is a neurodevelopment disorder affecting the brain, and it affects we have several neurodevelopmental disorders, and epilepsy, let me name them. 1 is autism, 2 is ADHD, 3 is spinal bifida, the other one is epilepsy, the neurodevelopmental problem. And such a strange question: is it possible that times will come in the medicine when it will be possible to replace people's brain with another brain? Hey, Onik, that is a very complicated question. And if it comes, it's okay. If it comes, well and good. Technology will have advanced, and we will have a very nice, it depends with the discoveries and developmental of technology, And Sumana, welcome. Greetings to you and everyone. And Sumana, welcome. I'm answering questions on epilepsy and general questions that you can have. When I come here in the evening, what I usually do is to answer questions that people ask and the ones that are on my email. So Onik, that one for now is not possible, but let's wait and see. If it will come a time when that will be possible, we thank God about it. We thank God about it. Now, can children outgrow epilepsy? Yes, that one we have said. That is a question from my email. Anyone with any question, you can drop your question. We discuss. We discuss. Can alcohol or drugs trigger seizures? Can alcohol or drug trigger seizures? Very true. Alcohol and drugs can trigger seizures. Alcohol misuse and recreational drugs can increase seizures risk. Mr. Benjamin, as a doctor, is there medicine for someone who is too obese and fat are going to the heart? Is there medication to reduce the weight loss? Yes, there are several drugs that you can use to reduce the weight. There are several. For the fats, the cholesterols, we use statins and some other drugs. There are such kind of drugs like atorvastatin. There are statins that reduce cholesterol, and there are others that block the absorption of some fats. And some people also use antihypoglycemic agents, the ones that people use for diabetes to reduce weight, like sitagliptin, and the one that people use that I don't like saying because people are misusing it. They really abuse it, but it works for them. Can children outgrow epilepsy? Yes. Can alcohol or drugs trigger seizures? Yes. Alcohol is a very bad thing, and because it can trigger seizures, because when you get to my friend T, long time T, hope you're doing good T. I'm just answering questions about seizures and interacting with my friend here. T, you see, today we have Ansumana, we have Fiona, we have Onik. Thanks for tuning in. But if you are a new guy and you are watching, please, if you have not subscribed, subscribe to the channel. Subscribe to the channel. Let's grow and grow and grow together, and watch something. When you are a new person and you have subscribed, give me a message. Just tell me I'm a new person here in any of the videos. Now, let's continue. If you have any question, and check if you have liked the video. Likes they give impressions out there. I'm doing good, just busy with work, and that's what we need. T Beauty, when you are busy with work, very many things you avoid. Which of the drugs are kind of cheap? Atorvastatin. Fiona, atorvastatin is a good drug that you can use. If you can get it, that one can help that person that has that problem. You see, you can have it. So T, how have you been? Hope you are good where you are, and I'm happy you are being busy all the time. I'm happy you are being busy all the time. When you are busy, some shenanigans you avoid. You stay away from funny shenanigans. You settle on what is necessary. Now, are convulsions only type of seizures? No. Some seizures are staring, confusion. It doesn't mean that only convulsions are types of seizures. No. There are absent seizures that someone just stares on you or drops down completely slowly. Sudden fall or brief muscle jerks or shaking. Like atonic seizures that we have talked about today. Atonic seizures. You understand, atonic seizures, people don't have convulsions. You just do what? You just fall down abruptly. You see? Sorry, my flus are making us so bad around. Can epilepsy be seen on an MRI scan? MRI looks at I'm tired and yes, too many shenanigans. I just keep people I want to support. Very important. Keep people who are positive and they are helping you. Even in online, stay away from negative shenanigans. You keep people that you feel they are giving something in your life. Anyone that you feel this one is a wastage of time or is a negative, stay away. Positive vibe is always good. Since people, but the fake ones, I just hit unsubscribe. Yes, very important for me. I don't like negativity. I don't like. I stay away from negativity. I don't like. I like being happy. I like smiling. I like joking. So that is my nature. So T, please always be busy. Keep off negativity, and God will bless you. What test is commonly used to? Oh, there is this question that I hadn't answered correctly. Sometimes MRI scans show a cause, but the scans can also appear normal. You can do a scan. You are checking someone's brain because he is epileptic. You too much, it drains. Drain. True. You can check on an MRI is okay, but this person is having an epilepsy. So the best thing that you can do for a person who has, can I get atorvastatin from the pharmacy, Mr. Benjamin? Yes, it is called atorvastatin. Fiona, atorvastatin. It is called African Village Girl. African Village Girl. African Village Girl. Where are you at? Near getting married. Atorvastatin. It is called atorvastatin, and if it is an adult, you do 20 milligrams. You do 20 milligrams, okay? If it is an adult, you do 20, not 5, not 10. And you have to take them for 3-4 months daily. They will reduce, but you check on a doctor. It's good to go to a doctor's advice, So, Onik, thanks for sharing my live on your Instagram. I hope if anyone has another Instagram, you can share this live on your Instagram so that we can talk. Life with the Russells. Hey, hello, Life with the Russells. Welcome to our question time. African Village Girl, which part of this country or which part of this continent are you from? Please tell me where you are chilling from. Life with the Russells, welcome to the chat. Thanks for you tuning in and coming in here. I'm just answering some questions, feeling good with some people, and we had some new people previously, like Claudia May Forhad. You see, Claudia today gave me $1 and from Guatemala. Claudia is from Guatemala. And then we had Roberta Ramos, some good new people in the house, some positive video, people that are coming in, and we feel nice having some new people. So let's continue liking the video. And there is something that I want to tell, that when you come to a channel like this one, and we are answering questions and we are relating and we are talking, you understand, we are talking. It is good to give your views on something. Don't just keep quiet, because medicine is diverse. And when you air your view, don't care about someone who will tell you that, no, that one is an illiterate way of thinking. No. In medicine, we don't have any illiterate way of thinking. We relate, because the things that people say are illiterate way of thinking, they come from our forefathers, and our forefathers have experience. Please, if you have not watched my playlist on contemporary medicine, how people, there is Ebola in Uganda. Sorry, keep away from people that have flu in Uganda, Fiona. Keep away from that virus. Now, when there are a few cases, you'll be protected by the blood of Jesus, Fiona. Don't worry. Just pray God and stay safe and keep sanitation good so that you cannot get Ebola. Right? So if you have not watched my videos on my playlist that is called complementary medicine, please go and watch the videos on complementary medicine. You will know why I'm saying there is nothing like illiterate way of thinking when it comes to medicine. If something can save life and is termed as illiterate, that's what we want. Okay, let's continue. I'm still answering question. Can missing one dose of medication trigger seizures? Can missing one dose of medication? Yes, especially in people with seizures are uncontrolled. People that have uncontrolled seizures. Yes, welcome my friends. Those are new, you know what to do. Subscribe. And I usually ask people, we come from different diversion, traditional and cultural places. So I usually ask people what people say about these topics where you come from. Like, what do people say about, people will always do some things to help a person when a person has a problem, yeah. So I want to go through some myths, because these are and if you have some things that you think people say that you don't concur with when it comes to epilepsy, please bring them out so that we can talk about them. We can talk about these things. Myths and facts are very important, because some people can destroy someone with myths, like putting a stick on the mouth. That is something that I've been asked every time, and I've explained why we don't have to put sticks in the mouth from a person who is convulsing. Now, atonic seizures are just falling spells. We talked about atonic seizures today, and we said atonic seizures are when you're just seated and then you fall down because the muscles have lost tension. So atonic seizures are caused by abnormal electricity in the brain, while fainting is usually caused by reduced blood flow to the brain. I want us to take that fact so correctly. Atonic seizure is caused by abnormal electricity to the brain. The abnormal electricity to the brain, you see. But there is something else that is called fainting. Fainting is caused by reduced blood flow to the brain, oxygen perfusion to the brain. So those two things are different. So now the difference between atonic seizures and fainting. Atonic seizures is caused by electricity imbalance in the brain, you see. But fainting is because of hypoxia, loss of oxygen, loss of blood perfusion to your brain. So those two things are totally different. So if someone just says you that this person has an atonic seizure, always just falling, that is not true. You understand? That is not true. Myths. A person always shakes during seizures. There are some people who are used to, if they see a person falling down and that person has not shaken, that person has not shown any sign of convulsions, that is not a seizure. That is not a seizure. We saw the kind of seizures like the ones that are called, the kind of seizures that are called what? We saw the kind of seizures that are called absent seizures. The absent seizures is whereby a person can just stare at you like this for seconds. This person is out. If you talk to this person, is not responding, and then he comes back and asks you what has happened. So the traditional way of thinking that a person can just fall down always and convulse, that is why it is called a seizure or epilepsy, those are not true. A seizure happens in very strange ways. Eh? Fiona and Onik are good guys. Yeah? Can an MRI show past seizures like an EKG can show past heart attack? No. An MRI cannot show past. Even coffee cakes, we have said, there are at times whereby a person has a seizure, but the MRI shows the brain is okay. You know, the better thing that can help you to show that there is a problem with your brain electric function is called an EEG, electroencephalangiogram. It shows the electricity system of your brain. And that one, you know, seizures and epilepsy are brought by the abnormal electricity in the brain. You know, abnormal electric function in the brain. So you may have a nice brain physically, everything is fine, but the problem is there is abnormal electricity. There is abnormal electricity, and that is what we usually look at. Abnormal. I have had EMGs for my nerves. Okay, how did it go? I know you have done them, and they show the electricity reactions. You know, they show the electricity reactions, and it is a good. That one is better for the brain rather than doing the MRI. MRI will show structural damage. MRI will show structural damage, and the EEG will show the electric function. Yes, we continue. A person always checks during seizures. That one we have talked about. Atonic seizures are fake or attention seeking. I've seen people being coming to hospital saying this person is just seeking attention, falls down by himself and wakes up. It may be atonic seizures. It may be atonic seizures, and you are saying this person is faking. It is not good to check. Also, always get facts from a doctor. Okay, so what's the next step if nothing on MRI? So EEG will show past seizures. I've never had EEG. EEG is very important, coffee cakes, because if the brain structure is okay, EEG will show the electrical functions. And if we see they are not normal, the electricity function of your brain, we will come and know that, okay, you have been having past, oh, Beauty is here. Beauty, welcome. You have been having past epileptic sessions. So we will know this is the problem. So it is important to have it, to do it. That one can show. It can give us head-ups about past convulsions. It's very true. It can give us head-ups about past convulsions. So it's better if you do an MRI, and then you see that the MRI is you see that the MRI itself is okay. Go on and do an EEG to find out if the electric system is okay. You see, seizures only happen in children. No, even adults. They are most common in children, but there are adults who have the atonic seizures. So both of you can get them anywhere, in children and in adults, but they are common in adults. Susan, welcome to the chat. Susan, umenitupa sana. You are good, and you are doing good. Beauty is here. Let me welcome Beauty and Susan at the same time. Why would my neuro stop at an MRI for my dystonia and not see anything to cause? Why would they have me on EEG? Why just diagnose me? You know, coffee cakes, it depends with the how your neuro saw and the examination that your neurosurgeon did. So if he saw it's not, but you can request for yourself. You can just see your neuro and tell her, the neuro that I request you do an EEG because I heard Dr. Ben talking about it. Maybe it was at least of your neuro to do it because the neuro saw it has no part in your treatment. It has no part in your treatment. You see. So that is it. My friend Susan Mwende, Susan Love. You have gone so long. Please don't go so long. Always be hitting on my channel. I know that you are doing good. You know, when you go so long, we start panicking. I missed what you said. Gonna rewind. Oh, I'm saying coffee cakes. Maybe your neurosurgeon saw it is not of help, according to him, and his what? According to him and his examinations to you, dystonia are caused by nerves that are affected either by an infection, compression, and several issues, and also other complications that are genetic. So maybe the diagnosis of your neurosurgeon had did not lead this to an EEG, but you can talk to your neurosurgeon. You clear your head about the EEG. You can do it. It's a simple test, so that you clear your head that you don't have any abnormal electric functions in your head. Or they did it one day when you are in theater and you didn't know, because there are some tests we do when someone is in theater and we see it's clear and we stop, we go on to the next, like the MRI. So that is it, my friend Coffee Cakes. So welcome everyone in the platform. Welcome everyone in the platform. If anyone has any question, please put that question on the platform. Let's interact, my guys. Let's interact. We have had so many new people today, and they are good people. They have talked to us, they have asked questions. So my crew here, always Onik, Beauty, Coffee Cakes, everyone in the house, big up all the time. Susan Love Official, Susan Mwende Official, big up all the time. Although Susan, you've lost, you have gone for so long. I still want to talk to you, and you are gone for so long. Always be talking to me. T Beauty is here, always here. Thanks for and love for I appreciate your concern. And let's be positive and everything. Let's thank God for life. Give thanks to life. Okay, I'll be joining. Big up to you, Doctor. Beauty, thanks a lot. Beauty, thanks a lot for everything. And I said that day I can have like 2-3 days to visit next year, to visit South Africa. I hope I will see Beauty. After I've come from Jamaica, I'll have like 2 days to visit South Africa. I hope, Beauty, I'll see you, Beauty from South Africa. Atomic scissors are harmless, but they are short. They are not harmless. Even though they might last for seconds, sudden fall you can get head injuries. Those are myths. Cuts or fractures, they can get you to have injuries. You see, means atomic scissors mean a person has low blood sugar only. No, low blood sugar can make you fall, but atomic scissors, we have said, it is electricity that is imbalanced from your brain. So low blood sugar only is not a sign here. It's not a sign here. You should hold the person tightly during the seizure. Please never do that. When a person is having a seizure, never pin this person down. Never pin this person down. Never, when a person is having the convulsion, never pin this person down. Do you know why? Those electric systems, they make the muscle so stiff and they make the muscle so hard. So for you to pin that person down, you are pinning this person down and you are rupturing the muscles. Don't do that, my friends. Please don't. Leave that person to, just turn this person to a recovery stage and let the person be until. But if the convulsions go up to more than 3 to 5 minutes, find a way to hospital. Putting something in the mouth, preventing a seizure. I'm still being asked that question. I've said no. You see, I've said no. You see. So I'm about to finish, my friends. I'm just about to finish. Anyone with any question, please ask. Anyone with any question, please ask. And share these videos. They can help someone. Share these videos, they can help someone. And it is important when we are helping people. It is very important when some people are being helped by our initiatives. If someone comes to my inbox and tells me that doctor, I followed your video and I heard about this topic that you were talking about, and it has really helped me. I thank you for that topic. I really feel good, guys. People say we come to YouTube to get money. Yes, there are some tokens here in YouTube, but the token of life, saving a person's life and saving a person to live, is so nice. As a doctor, you really feel that you've tried your best. You feel like everything that you wanted has happened. So when I'm coming to these lives and I'm talking to you and we are interacting and we are, please share this. Let's have those sessions when a person is coming and saying, I tried what you told me and everything is good. You see, and everything is becoming so better. I'm enjoying it. I really like when a person says that. So let's continue, my friends. Let's continue. Thanks for the support. The next question I have from my email is, helmets are unnecessary for people with atonic seizures. Helmets are very important for people with atonic seizures, and they are walking out there. Having helmets is very important, because this, you can be just and then you lose tension in your legs and then you fall down. Atonic seizures. So it is very important to do what? To put on helmets when you are away from home and you are at a rocky place. That's why you see some people in some countries, they walk around with helmets, and then you say that one is an engineer. Some people are you have seen people in China, in some continents, wearing the helmets and they are walking with them. It's not that they are engineers, it's because you don't know that those people have this particular type of epilepsy that is called atonic seizure. Your muscles just lose tension and strength and you fall down. And hitting your head when your muscles are losing strength is a very complicated thing. Atonic seizures are rare and untreatable. They can often be managed with anti-seizures. They are not untreatable. They can be managed with some. And my friends, Sunday blessing, Dr. Ben. It is Sunday blessing. Today here is on Monday. Imagine. Yes, shut Raven. Here it's on Monday. You where you are is on Sunday. God is great. Imagine. Thanks for liking. My big sis. I saw you driving with your daughter and showing us the serenity. I like green, and I liked that video. When I see green, I feel nice. I feel so nice. So we have said nutrition is very important to people that have epilepsy. I'm hungry, but I'm lazy now. Now eating dry granola. What is granola? I don't know what granola is. Please tell me what granola is. Now, I've said, people that have epilepsy, it is important you consider your nutrition fatty and protein. More fats, they help protect your Oh, oats. Okay, I see. More fats, they help protect your what? They help protect your nerves, and they reduce the convulsions. But people, when you are epileptic and have some attacks and then you are on carbs, you are always taking carbs, my friend, you are exposing yourself to more episodes of epilepsy. So nutrition is very important. Eh? Nutrition is very important when it comes to epileptic episodes. Avoid carbs, do keto. Do ketos, they will help you to reduce the epilepsy episode, the seizures epilepsy. As much as these atonic episodes are here, please always know how to manage. Bright lights always trigger atonic seizures. So, my friends, this is, by the way, there are some sessions that we are trying to, a crew that I have, to come up with special editions that we will be going to theaters. We showcase what is happening there. We showcase what is happening. Most of those things will be happening in members only. So that is what we have discussed. So as you plan to, when the sessions are coming, you plan to buy your members only, because we will be having some guests here that are having experiences from before, and exclusively. Whoa, Share Travels, thanks for that. Thanks for that, Share Travels. Good topic. Yes, I've just cut short to explain. So when you want to listen to people's experience about a disease, when you want to listen to people's experience about some issues of life, the real issues of life, that one will be happening on members channel. Because in some institution, you just don't go in. You have to facilitate some things, and there is a members. So be ready to start having the members group. I know most of you will be in the members group, and we will be sharing those there. But every topic that we have, like these ones, will be going on as normal. So the exclusive of members channel is because you will be meeting some new people and always meeting the real medical life of a doctor and the patients and in the hospital. But you know, that one needs some signing of the contracts because of rights of the patient. So that is what we are coming up with. Welcome everyone. Coffee, Share Travels, Coffee Cakes, everyone. T Beauty is tired. She's a jovial girl and hardworking. T Beauty, continue with that spirit. Thank you so much, and always be praying God to give you more strength and energy. Like me, I usually pray God to give me strength and energy so that I can see my son one day running my hospital. So let's pray to God to give us the strength. So Share Travels, thank you a lot for that one, and I thank, and where it has come from, you know, God will bless you big time. God will bless you big time. Now drop it out. Let's go to the questions. We are just about to finish them. Atonic seizures and sleep attacks are the same thing. No. Sleep attacks is when you are tired and melatonin is being produced from your brain. Melatonin is being produced from your brain. That is sleep attacks. It is sending your body to rest. Atonic seizures are electrical impulses. Dorothy, welcome. Dorothy, I can see you. Thanks for being here. Share Travels, my sister. Today I started a video, and then I went to a procedure. Although I did not showcase, I was doing the procedure. Some people are seeing syringes and they run away. They ran away from the video, because I've seen today. I've seen some people. My friend Nana and Mom. Hey, Mama and Nan saw a syringe and she ran away from the chat. That is the life of a doctor, my friend. That is the life of a doctor. So if you have not watched that session, when I was live and then a patient came and I had to do it. So I didn't cut the live session. I just went, although I did not showcase the patient, but I showcased the procedure. Check on it. Check on that live. It was the one before this one. Atonic scissors, a procedure as we do atonic scissors. Please check on it. It was really motivating. It was really, even I heard a person saying, so Dr. Ben is a real doctor, right? Very funny. It's very funny sometimes. So if you have not watched it, please go and watch it. It was a good session. Now, Dorothy, welcome to the channel, Dorothy. We are just answering random questions. So if you have any question, and please, for the new guys that are dropping, if you are new, subscribe to the channel, like the video, you will get more notifications. Now we get another thing here. Those people that have atonic scissors, atonic scissor is different from the other scissors. The other scissors, you may stare, you may get convulsions, you may get, you may fall down. This one, you just fall down because your muscles have lost strength. So a person here is asking, is a person with atonic epilepsy able to go to school or work? Yes. Many people with epilepsy, including every epileptic problem, these people go to work under medication. But there are those that are limited to driving, limited to some things. Heavy machineries, they are limited to them because this person can be handling a very heavy machine in a factory. I don't know if you have ever gone to some paper industries. Heavy machines that have big gears and then they injure themselves. But they are given work according to their presentations and the doctor's prescription under medication. So a person who is epileptic, the first thing, that person can go to school. The neurodevelopment problem in epilepsy does not injure or does not destroy the cognitive function of a person. Most of the neurodevelopmental problems that affect the cognitive function mostly maybe is autism, and it depends with the grading, and ADHD. But here it does not. It does not affect the cognitive function. So my friends, atonic scissors, people go to school, they learn well, they do the exams, they pass, they go to university, they become professors. It's just the genetic problem that it comes for a while because of the electric systems, and people learn and they get well. Atonic seizures are caused by possessions or curse. I don't like talking about possessions and curses. No, things that are spiritual are very complicated, and only God can redeem us from some things. So if you see someone who has epilepsy or this person has atonic seizures, please don't always judge this person and say that this person is cursed. Let's I know of many communities that say that when a person is having a seizure, that person comes from a community that has voodoo. No. If you are here and you are watching, and there are people who comes from those communities, share with them these videos. Let them learn. The people from South Africa, Esangoma. I remember the song that someone, Yvonne Chakachaka, that was singing about Esangoma. Those are traditional healers. This is a purely medical situation of neurodevelopment disorder. So everyone who is here, Coffee Cakes loves it when I'm singing. Coffee Cakes, wow! You should you watched the last video that we were with Jamaican Uncle. It was a good session. It was a really good session. Atonic seizures are always inherited. No, atonic seizures are not usually inherited. Some epilepsy have genetic links, but not all atonic seizures are inherited. Every person is built. If you are a woman and you are pregnant and you have diabetes and you are not controlling it. The second one, you are taking alcohol and drugs while you are pregnant. It can, I will miss a lot on travel and signal. Oh yeah. No worries. Please, coffee cakes. Please download WhatsApp. It's very important because with WhatsApp I can just leave you a message and tell you when you are okay. Please let me call you, and I'll call you and we talk. Please download WhatsApp. Now, once seizures improve, medication should be stopped immediately. That question is always being asked. Can a person stop medication when the seizures are reduced? Stopping medication suddenly can trigger more seizures. So if you are in continued medication, never skip, never stop, unless your doctor tells you, let's reduce or let's do this. See, this is very important, my friends, and I think, what do you think about my presentations? Sometimes it's good to analyze and to be given the real reality. If you think I'm presenting well, please tell me. If you think I should improve on something, please tell me. If you think I'm going out of topics at times, please tell me. You see, so I've answered questions about atonic seizures. I think my time is about to end. I have like 10 minutes, I see. And they say key features of atonic seizures are sudden loss of muscle tone, head dropping and falling like this, usually very brief, increased risk of head injury, and common in syndromes like Lennox-Gastaut syndrome in children and Douce syndrome. These are in children, where the children just fall and they think they are asleep and they are convulsing. Lennox-Gastaut syndrome and Douce syndrome. So the treatments, mostly I don't like going towards treatments, but I'll just give an overview. Treatments for epilepsy, you have anti-seizure medication, ketogenic diet. We have talked about diet. Don't do carbs, do ketogenic diet. Vagus nerve stimulation for those that have more seizures that are going more than how many episodes? 5 episodes. Protective helmets and surgery in selected severe cases. Surgeries are done to people that have seizures and they have tumors in the brain, or they have fibrous layers in the brain. So that is it, my friends. I think I've answered some of the questions, and anyone who has a question, please ask me. Anyone with any question, I'm waiting. Anyone who thinks you have a question, please ask. I feel you explain to us in layman's term and can understand. If we don't understand and ask you explain, I appreciate that. I feel you present well. Thanks, Kofi. Thanks, welcome for everything. And now, my friends, start preparing for the members part. Some good things are going to come in there. The real life situations. No, doctor, on my side, you're doing an amazing job. I learn a lot from you. Thank you, Beauty. I'm going to bring some real life situations and real life surgical processes here. And I'm going to talk with people that have real situations that we have talked. And those ones are kind of like sensitive. They need documentations, they need some contracts, they need, and we will put them on members only. So if you are here preparing, it's good you start preparing for that journey. So everyone who is watching, thanks for coming in. And I know we have kids, we have relatives that are, Coffee Cakes has given me member. Wow. Coffee Cakes, welcome to Rabbit. yes, welcome to Rabbit, Coffee Cakes. I'll give you a badge that I know, I'll select. So I'm going to start that very soon. There is a crew that is planning. Coffee Cakes loves rabbits. Coffee Cakes, have you ever eaten rabbit meat? So sweet, so sweet. So welcome to these sessions. I think we are done. And is anyone having any question, my friends? Anyone with any question? Anyone who thinks I've left outside something? Because it's 10:53, close to 11, and I want to, hey, my brother. Wow, Coffee Cakes. Receive a gift by the Coffee Cakes. Just lovely, dear. Receive a gift by Coffee Cakes. Welcome. Oh, Members Day, people. Today we are getting more members, and exclusive videos are coming to the membership. So don't worry, you will see what we will be doing on membership videos, because medical. Let me talk about this. Medical channels that are coming live with some things. There are some places where we need to be ethical, and we need to do things documented and in a legal way. So when it will come to real life situations, you understand the documentation, doing things in the legal way, doing things in the way that it is supposed to be done. Because if I'm bringing a patient on board, I really need to have an oath of understanding and signed some documents, so that one day we don't have problems with regulatory boards of our country and the patient himself. It is very important. These are just lovely. Receive a gift from the coffee anywhere, anytime. You see, so let's be patient as I'm preparing these things, and we will grow together. I'm really waiting for my sister Sha Travels when she's coming to Kenya. We should have a video with her. Sha Travels has been I knew Sha Travels just recently. She was working as an ophthalmologist in optical, So when I'm talking about the nerves of the eye, the oculomotor, the what, Sha Travels knows. So when you come to Kenya, Sha Travels, be ready to have a session that is called members only intervention. I didn't know. You challenged me when you said that you are working on a ophthalmic department, and I liked it. So if I was talking some things that are not making sense, you could tell me, hey, you stop it. We don't do it that way. And I appreciate. I'm that person who appreciates being corrected. So if you know of something that is medical and you want to correct me, even if a person is in the channel, I did for 26 years, Dr. Belly. Imagine, Miriam, Sha Travels did it for has retracted that message. Wow. Yes, these are things that we interact. And 16 years, yes, imagine. Chat, check to see if settings are in the chat to accept gifts. So next time YouTube chooses you for check. Yes, I'll check it. That's very important. Coffee Cakes is saying, chat, check to see if YouTube settings are in the chat to accept gifts. So next time YouTube chooses you for a membership gift, you can be given. Yes, very important. I realized when you are a member on a channel and it's doing some good topics, YouTube can decide to gift you directly. I didn't know. I knew it recently. YouTube can gift you directly. So as we starting the membership channel, sometimes YouTube can just decide to gift you out of my knowledge. Yes, I can send you videos on membership for emojis, and yes, I see. I get the same questions. Are you really a doctor? Shah travel. Yes. When today I was on that on the procedure that I was doing. Please watch the video that I did with before today. Everyone was asking, so it is true this is a doctor, a real doctor? I did that procedure, and yes, you cannot come live. In Kenya, we have a regulatory board, so you cannot come with such topics and you are not registered. You cannot own a facility that like the one I have if you are not registered doctor. You cannot. You have to present you have to, and you've seen, I go inside the hospital is written my name. You have to own and be licensed by the regulatory board for you to present such things. Unless for a few minutes or a few days I could be out of So let's learn. I know people confuse me being a doctor because of my vibe. I like music. I like interacting with everyone. You know, I like interacting, and the people they have the notion and the mindset that if you are a doctor, you should be a serious person. There are some things you should not be doing, like coming online. Don't worry about that. As long as the person who is coming here and is getting help and is supporting, you see, it's good. So the person who is a doubting Thomas, let that person continue doubting. We thank those people for doubting. We thank those people for doubting. You know, yes. And Doctor. Change Dr. Ben, continue. Don't change Dr. Ben, continue, my brother. I love this vibe. I will never change. I will, even my patients. One day, if Jamaican uncle was in this hospital one day, and what do strobe lights cause epileptic seizures? Because, let me finish about this. Jamaican uncle was in this office and saw how I'm interacting with the patients. He told me, guy, I've never seen a doctor like you. You are always laughing, talking to the patients as friends, and even your staff, you can't know who is the doctor, who is the boss. You are all talking like you are the same staff, and that is the vibe I'm used. That is how my parents brought me up. That is how I live my life from home. So let me answer the coffee cakes. Why do strobe lights cause epileptic seizures? Because this is the second cranial nerve is called optic. It gets the image and transfers them to the temporal lobe and then takes them through the brain to a place called amygdala to keep them. So when strobe lights come like this, they excite a funny electric presentation to your brain. So when it strikes a funny electric presentation, you know, seizures is not something like fainting, like the brain has no oxygen. This one is excited by electric system, that your brain. So the balance goes away. You start having an abnormal balance of electricity. It starts from your eyes. Starts from your eyes to your brain. So when it comes and strikes you, my friend, you start having a seizure. Optic nerve. The first nerve is called olfactory for the nose. It's here in the frontal cortex. The second one is called the optic nerve. So that is why it happens. What makes blood not to go to the head? One, if my friend have the problem, maybe clotting Thanks, Share Travels. Maybe clotting. The second one may be low HB. Miriam, there is two things that we need to understand. There is blood not going to the head, and there is oxygen that is less to the head. You know, those two things are different. If you block your blood vessels, somewhere maybe you have a clot, enough blood will not go to the head, so enough oxygen will not reach. You can have anemia. You can have anemia. So we have microcytic anemia, that your blood cells are having good hemoglobin that is carrying enough capacity of oxygen to the head. That is another problem. You don't have clots, but your hemoglobin is not enough to carry oxygen to the brain. So these are things that we look at. Several things. Please, Miriam, check on the topic of anemia that we did. Go through the videos, you will see the topic on anemia. You will understand so well and so cool. So I think today's session has been a very nice session of associating and talking about these issues, and I thank everyone that has come on board. Unless if there is someone that is here and you know, these topics are helping some people to understand. Like Miriam, I've referred you to the topic on anemia. You will get all this. You'll get all this that I'm speaking about. Hey, King Nero. King Nero, how is the going? Today I met King Nero in a channel. Oh, it was on Shah's travel channel. King Nero, when Shah was driving with the daughter. King Nero, welcome. Even if you have come late, hit your like button. Leave me with your thumb. Hit me with your like button. I like it when you come here and you see, give me your like, give me your like. And if there is any topic that you would love me to do, we talked about health system. I was talking about, check the video that I talked about on health service management. The Barry walking exercise. King Nero, I've been here for 30 minutes. King Nero, when you come, the first thing, tell me, hey boss, I'm around here. Where do I sit? Yes. I did a video on health service management, HSM. And I started, you know, when I do my things, I do them practically. I started from investigating the cameras, coming to the reception, going to the matron's room, coming to the linen place, coming to the examination place. Please watch that. It will give you a sense of being a manager. You know, for now, I own a hospital that is an outpatient service hospital, but it's like I'm the manager. So I was showing some people how these things are. I was showing some people how a manager should operate for a smooth run of a facility. Hello, Shah's Travel, Dr. Ben is the real deal. Thank you, King Nero. Thank you, King Nero, for that. Thank you, King Nero. So I have, let me say, that is 7 minutes. Anyone who has a question, 7 minutes to go. 7 minutes to go as we say goodbye to each other. Barry walking exercise is here. Barry walking, thank you for everything. Thank you for everything that you. I want to walk with Barry walking exercise one day. I want to walk with Barry walking exercise one day. And yes, he is been following him for a minute in Nero. Yes, I want to walk with Barry walking exercise one day. Coffee Cakes is here. So my friends, it has been a good session of questions and answering. And I told you what is coming up. We should upgrade as we go on. We should upgrade as we go on. So for the moment, it's a good. Next month I might have one patient that one patient. I just want to start with one patient that was a real good deal. This patient had lost, he had a problem with the chest, and the lungs were shutting down, but the patient had lost hope, and he came to me as the the person who had a last option. Let me just try. And I saw the patient came for a revisit just a week ago, and the patient was really thanking me for everything, for reviving him. How a patient can be. I want to come with that patient live one day. We speak to the people so that we can know how things are in the reality of a life of a doctor and a client. So be ready for that. When it will be coming, I'll put it a week before. I'll have documented everything, and you will appreciate. So welcome everyone. Barry Walking Exercise, continue giving us the morning exercises. Continue telling people, if you are depressed, you want somewhere to relieve yourself, come to Dr. Ben. I thank Barry Walking Exercise. Barry Walking Exercise walks and shouts my name and tells people, when you want to feel good, go to Benjamin the Wise Guy, and you will feel good, and everything there will help you. You see. So, bye guys. I thank you for that. I think there is no any other question. Let me end today there. We meet tomorrow at 4. Let's meet tomorrow at 4 so that we can continue with our topics, and we feel better when we interact. So everyone that is here, thanks so much, and have a lovely day wherever you are. If you are in Kenya, in Africa, sleep well. So bye. See you tomorrow. May the Lord be with everyone that has been here. Bye.